So we are live now.
Okay.
Hello guys, welcome back to my channel. I trust we are all doing so well. If you've really joined us, kindly share this video with your friends and also kindly share on your social media platforms as well. And I would really like to know where you are also joining us from. It's very, very important for us to know my Ghanaians, my Nigerians, my Zimbabweans. Recently, I had someone from Benin. It's really satisfying and kind of encouraging to know that we have lots of people from different places. So kindly drop in a comment and let us know where you are joining us from. And then we will allow our guests to also introduce themselves. Hello, Christabel. Thank you so much for joining us. Where are you joining us from? Kindly share, let us know. Faith, thank you so much. She says, "Hey Lucy, I've been counting minutes for this since 8 a.m. Wow, that is so encouraging. Thank you so much. Ifwa Prempe, Ifwa joining from Ghana. Oh wow, my Ghanaians, you guys are so supportive. I really, really appreciate you all. Tomi Lanyo says, I'm joining from Nigeria. Thank you so much, my Niger people. We'll definitely come back to debate on Ghana Jollof and Nigeria Jollof because it's very, very important. Andy Spiritual says, I'm watching you live from GH. Thank you so much, Angie. Felicity says, hello, nice Momo. Felicity from GH. Hey, Felicity, I really have to give you an award though, because your support is so massive. I really, really appreciate it. Thank you guys for joining in. Please remember to share this live session on your Facebook platform, on Instagram if you're on Instagram, on TikTok as well. Please help us out to spread this wonderful session with your friends as well. And please, if you're a nurse here and you belong to any nursing group, any WhatsApp group, please share this live session with them as well. Let's encourage people to also know what adaptation and RCSI is when it comes to Ireland journey. Thank you so much, Yao. Says Yao from Ghana. Thank you so much, Yao. Thank you, Alexandra. Keep up the good work. This is Kobe Jones. Hey, Kobe, thank you so much. So Kobe is also a coach on my Telegram page. He's so helpful and very, very active. He's always there to help us. And then I have Bismarck watching from Ghana. Thank you so much, Bismarck. And I have my one and only man, the man behind my back, my husband. He says, love from Ghana DH. Thank you so much, Osby. I appreciate it. Always on my live sessions just to keep me going. Thank you so much, baby. You guys are all smiling. So, guys, today I have here with me my fellow Irish nurses from different disciplines. They are here to encourage us and also throw more light on adaptation and RCSI. Because lots of people kind of always misinterpret when it comes to the exams for Ireland. People think that they still have to write the CBT and also the OSCE, just like UK. But today we are here to show more light on what adaptation and RCSI is when it comes to Ireland. So welcome, Sandra. Welcome, Nathan. Welcome, Ness Abuna. Welcome, Wendy. I really thank you all for joining me on today's session. Kindly introduce yourself, starting from Nathan.
Okay, my name is Nathan. I'm an Irish nurse and happy to be here with you. Thank you. I'm an RGN anyway.
Ms. Abuna. Okay, we'll move on to Wendy. Abuna is having some few.
Hi, I'm Wendy, also an RGN here in Ireland. Happy to join.
Thank you.
Hi, I'm Sandra Andersonata, a midwife also here in Ireland. Nice to meet you all.
Thank you all. Okay, guys, so we are going straight into today's session without wasting any time. I have some few people that I'm going to acknowledge, then we'll just go straight into it. It's very, very important. I have Sekina SMS from Ghana. Thank you so much, Sekina. my one and only Sekina, always behind me, always supporting and always pushing me to do my best. We have Benito, thank you so much. Abigail, thank you so much for joining us. It says, good work, Sister Lou. Thank you so much. So, guys, we're going to start with what adaptation and RCSI is all about. So I'll just do a few introduction in terms of your discipline, so other people will know. So I have Nathan. Nathan is a registered general nurse. So he is registered in the general nurse division. And then Sandra is a midwife. Abna is also a psychiatric nurse, just like myself. But Abna is part of the first batch that wrote the RCSI, RCSI for psych nurses. So she was part of the first batch, and she has so much experience when it comes to that of the RCSI for psychiatry. So it's very important that we have her here today. So please, when it comes to RCSI, Nathan and Abna, I'll have Nathan first. Can you tell us a little bit about RCSI?
You mean adaptation, right?
Sorry, yes, adaptation.
Okay, so basically, adaptation is a process that's meant for nurses that have been trained outside the European Union. And so it's supposed to last for a period of 6 to 12 weeks. And in extreme situations, it can be extended from the 12 weeks to 18 weeks. That is the maximum. And during which you would be expected to meet certain competencies. And if you're satisfied, I mean, if your preceptors are satisfied that you've met those competencies, then you're signed off, and then you get to receive your Irish PIN. Yeah, basically that is what the whole adaptation process is all about.
Thank you. Sandra, can you tell us a little bit when it comes to adaptation for midwives?
Okay. So basically, that's what Nathan said. For us midwives here in Galway, we do adaptation for 12 weeks. So it's not 6 weeks, it's 12 weeks for us. And sometimes for the RGNs, it's 6 weeks, 6 to 12 weeks. But for the midwives, it's 12 weeks basically. And you are assigned to your preceptor, the person who will supervise you throughout the 12 weeks. And also, you get to work on the various wards. So for us, we were stationed at one ward. If it's postnatal, that's where you would work. So your 12 weeks is over and you're signed off. Yes, basically that's it.
Wonderful, wonderful. Wendy, can you take us through that of the RCSI?
No, okay. So RCSI is for overseas nurses. To prove your competence, it comes in two parts. That's the CBT. So when you're an overseas nurse, you need to come and do this exam to prove your competence as a nurse. Yeah. So basically, that's the whole.
The whole thing about RCSI. Abna, I believe it's the same thing when it comes to RCSI for the psych nurses.
It's the same for psychiatric nurses. So the RCSI comprises of two parts. That's the CBT and the OSCE. So just as the general nurses takes it, it's the same for psychiatric, just that the psychiatric stations are slightly different from the general nurses, even though there are some stations that are similar to the general nurses, but others are strictly psychiatric. So maybe we look at that as we progress.
Oh, nice. So if you say the CBT, are you referring to, is the same as the UK CBT, or this is similar but just different names?
Yeah, it's CBT is just a computerized based test. It's just a name for any test that is being taken that is computer based. So basically, it's just a general name for exams that is being taken on a computer. So basically, when it comes to RCSI, the theory part is taken on a computer. So you can either call it theory or you can call it CBT. It still mounts up to the fact that you are doing a multiple choice questions on a computer, just as the UK people also do. So basically, it's the same, but different questions. Yeah, for sure.
Okay, grand. This time around, I'll go to Nathan. Nathan, when we talk about RCSI and then adaptation, I know that you're a general nurse, and then definitely you also studied for RCSI before you actually came into Ireland to undergo adaptation. Do you have any similarities when it comes to RCSI and adaptation? or
Of course,
difference?
there's a lot of yes, there are a lot of similarities. Now, definitely all the things that you study towards during the RCSI, for example, some of the stations are admission stations, wound dressing, false assessment, sepsis, and all those kind of things. It's literally the same thing that you're coming here to do when you're doing adaptation. Um, just that within the ward, you will not be kind as in the way it is in the RCSI. You have 10 minutes to finish your station. During the When you're in the ward, you have a little bit of flexibility. Maybe you have not seen it being done before. For the first time, the preceptor might be generous enough to show you, and then subsequently you're on your own. You're doing it. So there are lots of similarities, and those who are preparing to come, if your offer is adaptation, don't say I'm coming to do adaptation, and so let go of the RCSI. It's very important. It also helps you to quickly adapt because
Okay.
if you have no idea, for example, they tell you I need score of 6. You have no idea what the score of 6 means. Back home, you're used to temperature is equal to this, respiration is equal to this, and so you don't know what the I new score of 6 means, and you don't know what to do. It will make your like how you get to be integrated into the system much more difficult for you, and you never know. So it's very important that even if you're coming to do adaptation, you keep your RCSI study is very important.
Oh, okay. Thank you so much, Nathan. My subscribers are really important, just as you guys. I can see some comments here. From Miss Angeline, she says, please, aside Nurse Momo, I can barely hear from the others. So please, can we increase the volume of our set so that other people can hear us? And then Christabel says, Sister Wendy, we can barely hear you. So Sister Wendy, kindly come closer to us and let us hear you, please. It's very
Okay.
important. I really want to hear from you.
Okay.
Okay, so Sandra, I want to know when it comes to RCSI, you're a midwife. We know that the midwives are not supposed to also undergo the RCSI. It's mainly adaptation at your hospital, which is like getting used to your clinical setting, which you just told us. Is RCSI very important when it comes to midwifery? Is it important? Is there anything that you can say regarding this?
Yeah, I think our CSI is also important when it comes to midwifery. Just like Nathan said, there are some of the policies that relate to midwifery, like, for example, sepsis screen and the INEWS. INEWS. For midwives, we use INEWS, but it's somehow related. So if you know something about RCSI, you are able to walk your way through when you come to the aspect of midwifery. Yes, so it's very important.
Okay. Thank you. Thank you so much. Thank you. And then, Wendy, I know that for you, you did solely RCSI. So I don't know what if you want to say anything about adaptation or you getting after maybe your pain. I'll say after you getting your pain, is it difficult going like getting used to the clinical setting because you didn't have the opportunity to work in the clinical setting. So you doing straight RCSI, was it difficult adapting to the clinical setting or getting used to your workplace?
No, okay. So with the things you did during our CSI, it's practically the same thing you do during your clinical settings. So everything you did during our CSI, you shouldn't think that because it's exams, you're done with the exams and it ends it. No. Whatever you did in the exams, that is the same thing you're going to practice during your clinical setting. So that's it.
Okay,
You just
okay.
carrying on from there. Yeah.
That's
So there
wonderful.
wasn't
That's
any challenge or something.
okay, okay. Um, Miss Tina, the same thing goes to you because you all know that when it comes to psych, it's mainly about adaptation. But being the first batch that you successfully went through the RCSI, how did you find it? After passing the RCSI, then and now you're working, how do you find it combining the two?
Oh, it's a beautiful experience because everything that you prepared for to do in the RCSI is basically the same thing you are doing on the ward. Trust me, nothing is different from that. So everything that you took or every practical that you did for the OSCE, you are basically seeing it each and every day on the ward. You are seeing it. Aggression de-escalation, panic attack, everything is basically you see patients exhibiting every little bit of what you did during the OSCE. So it's more like the RCSI gave us much information or much knowledge and skills as to what to expect in the
Please, can we
clinical
increase
setting.
the volume? Our viewers are complaining they can't hear us. If we can please increase the volume. Yeah.
I think my volume is just, please, is it okay?
Yeah. A little bit
Is that
more.
fine? Okay, I think it's ended. Maybe I may have to take off the Bluetooth. Is it okay, please?
Yes.
Can you hear me? Okay.
Yes.
So as I was saying, I mean that basically what we did for the OSCE are the same things that we find ourselves doing on the ward. Everything that the OSCE we prepared for, they are actually real things that happens on the ward that we were being examined on. So it's actually prepared as much well in terms of the clinical field, because basically what we did in the OSCE is what we now find ourselves doing each and every day on the ward. So it's really enhanced us. So to me, it didn't really make the first day of our work any challenging, because as the days goes on, the basic things that we see on the ward were actually things that we prepared for the OSCE. So I think it was very good. The RCSI was actually a good preparation for us, both for the exams and for the clinical setting. It was a good thing. Yeah.
Right. Okay. So since you're already on, I want to find out how long did it take from the duration from the time that you had your pain, from the time that you wrote your RCSI to the time that you had your pain? Was it very lengthy, or just after that it was just easy for you to
Oh,
get your pain?
I think our results were released. We wrote on Sunday, and results were released on Monday. Yeah, results came on Monday, and I think in 3 days later, NMBI contacted us that we are due for the PIN registration. So we now have to do our PIN registration, make our payment. And so after the PIN payment, now NMBI gets back to us to fill some forms. They needed some more information, which we provided. So I think it ends there for you to get your PIN. But if your CCPS is out of date, they now request for an updated CCPS from Ghana, from a Ghana National Midwifery Council. So until they receive the updated CCPS, that is when they can issue the PIN. But if your CCPS is up to date for them, they issue your PIN immediately for you. So from RCSI to PIN is really a short period if you don't have any outdated CCPS. Yeah.
I can hear you, please.
Yes, I was asking when it comes to adaptation, how long does it take for you to also receive your pain?
Oh, okay. Well, so one, it depends on which week you're signed off. So, like I was saying, if you're fortunate enough to be signed off within your 6 week or in your 12 weeks, that would also determine, when you're going to get your pay. But let's assume you got signed off Monday. The hospital is going to send your particulars to NMBI. It depends on the individual at NMBI who is processing your document. Sometimes it will take about 2 to 3 days before they get back to you. They ask you to fill a form, and then, like my other colleague said initially, if you have an active CCPS, it could happen that you could get your PIN within 1 week, but maximum 2 weeks if you have everything on point. But in a situation where your CCPS is not, active, by active I mean that from the time you requested it it shouldn't be beyond 12 months from the time. It shouldn't exceed 1 year. Once it exceeds 1 year, at the time that you are ending your adaptation, so let's assume that I applied for my CCPS last year, March, and then I got signed off this year, April. It means that the CCPS that I got last year has expired.
Okay.
So knowing that, I should probably put in a registration request for a new CCPS so that by the time I get signed off, I will have a new CCPS. So let's all try and do that. I had colleagues from other nationalities who got signed off in their 6 weeks, but they are still waiting for their pin. And some of us who got signed off quite recently, even had our pin ahead of them. So getting your CCPS active is one of the essential things, and that could make you get the pin within a week, maximum 2 weeks.
Okay. Then Sandra, I believe it's the same thing when it comes to you because you are equally you also did adaptation. So I believe it's the same thing. Or is there anything that you also want to add when it comes to anything that's any nurse that finds himself in Ireland should do to prevent further delays when it comes to getting your PIN?
Sorry.
Yeah.
I think you said it all. Yes, you need an active CCPS, and if you don't have it, you have to wait longer for it. And immediately you get your CCPS, they can process your PIN for you. So the important thing is getting your CCPS active after you're signed off, and you're good to go.
Okay, thank you very much. I just want to find out from Wendy, can you discuss some things, some challenges that you faced during your RCSI and how you were able to cope with it? I think this question is going to
Okay.
be for everyone, actually.
Yeah. So for my RCSI, the challenges, first and foremost, we are used to this hot weather, and then coming here, being cold here and all. I didn't get into the country early. I think I got here 2 days before my exams time, so I hadn't adjusted well to the system. And you can't wear long sleeves in there. You need to be in your scrubs, and then no inner, so just the short sleeves. Cause we have a station
Yeah.
where you would have to check BP, and you need your cowl for that. So I was so cold in there, shivering, literally shivering in there, even though the heating was on. But the people there were used to this whole heating thing. Like, don't laugh at me, but it's serious. And I was anxious as well. So you can just imagine being cold and then having anxiety as well. Like combining these two, it wasn't easy. But one good thing is, unlike Africa or let me say Ghana, where exam setting, the examiners or the assessors, we all did practical exams and we know how this
Yes.
goes. Like
Mm-hmm.
they have this strict face on and then you are so tense and they're not even relaxing for you to relax. You know that then it's different here, way different.
Yes.
So you
Okay.
come in and then they have this smiling face, they're so nice to you. And when you're doing something, they realize you're shivering or panicking. They go like, "Are you okay? Can you continue? Is everything okay?" It makes you feel relaxed. It makes you feel calm. So
Okay.
with the anxiety part, like they really helped with
It
that
really
because they
helped
were
you.
so nice. Yes, they were so nice to us. Yeah, and I think
Okay.
that was all like the challenges
Okay.
I faced.
I'm actually coming to you now because I want you to tell me about some of the challenges. Being like you knowing that okay, this is my I'm the first, I'm part of the first batch coming in to take up this tax. I know it's very challenging. I definitely you also face your own challenges. Kindly walk us through. Let us know.
Okay, for for psychiatric RCSI, the biggest challenge was the fact that there was no Pasco. Unlike the unlike the
Yes.
general nurses, that's at least they have some Pasco guiding their studies. Ours wasn't like that, so it was really do or die affair. By hook or crook, you need to, study and pass the thing, get your pin, and then, be the Irishness you want to be. So basically, I can say that the only source of learning sites for us was the RCSI psychiatric website. So apart from that, I can say it was a challenge really getting to know how the psychiatric stations were going to be like. And I think the weather too. When this case, I also experienced that I was so cold in there because your scrub should be very short because of the vital signs patient. So, but notwithstand all these challenges, the assessors were really good. They were
That's
really, really good. No assessor is there to fail you. You only fail when you are leaving out some prominent steps that poses a risk to you or the patient.
okay.
Apart from this, every assessor there is that if even if you are making mistake, they try to give you clues to bring you back on track. I think
Wow.
um apart from the fact that we didn't get any pasco, because the CBT actually made us aware that we are actually going to face real psychiatric stations in the OSCE, because the
Wow.
CBT from question 1 to question 150 were strictly psychiatric questions:
Wow.
psychopharmacology, psychopathology, dual
Wow.
diagnosis, psychotherapies. My dear, it was strictly psychiatry. So, like, it prompted us that, Charlie, we should stand firm. We would definitely have strict psychiatric stations on the OSCE. And lo and behold, we had them, strict psychiatric stations, even though we had no clue of how the psychiatric stations were going to be like. But because of the RCSI preparation station website, and also from the help of our hospital, they really did well with some master classes preparations for us. It really helped. So there were challenges, but still we had a lot of support that really pulled us through. That's all I can say.
Wow, that's so encouraging. Thank you so much, Abna. Nathan, please let us know. You came in for adaptation. We all know that where you come from is the clinical setting is different from that of what we have here on the general wards. Were you scared? I know definitely there's going to be anxiety. What are some of the challenges that you equally faced? Because I know that there are some machines and there's some equipment that will be here that are not, you are not very familiar with. So let kindly walk us through some of the challenges that you equally also faced.
Looks like you are in my shoes. Anyway, the biggest challenge I faced within the first week, let me say the first day I entered the ward, was handover. The handover sheet was given to us, and she started talking. Literally, I couldn't understand anything. And this place they use lots of abbreviations and other things. I was still on the first patient, and people were flipping over. I'm like, oh my god, what's happening? Right? So language at the beginning was an issue. It's not like I don't understand English. I do understand English, but if you've been here, you understand what I mean. So handover has been one of the biggest challenges. How I overcame that was that normally I'll go a bit earlier, pick up the handover sheet, do the reading, identify the routine stuff that are going to be done for the patient and the plan for the day. And so when I go into the handover room and I'm listening, it kind of, it sounds better and I'm able to follow in my mind. Another issue is about the equipment that I use. These setting is, highly computerized and technology driven. Back home, we have different things we use to check vital signs. Here, we use a Dynamap. I haven't used one before, and so the first time I even had to be taught by one of the students that this is how you go about it. Um, you are doing dressings like back dressings, Veraflu dressings, ECG. Those are things that normally you wouldn't be doing as a nurse, back in Ghana. But these are the things that we do on a daily basis. And so there are times that if a patient of mine is supposed to have, any of these procedures, I'll either go to the internet and watch a quick video and see how it's done, and then, I go back and do it. It just doesn't come magically. It has to come with some practice. and you have to be willing to try. If you're always like, oh my God, I've not done it before and I'm scared, I may do something wrong, then you're never going to try it. And that also goes against you, during your assessment. So the willingness to try. And there are times that, because you're not so used to the word routines, you get daily feedback and they tell you your time management was poor. You didn't do well with this, or you didn't do well with that. The trick to that is that, let's say I work with Professor A today, give me some comments and some constructive criticism. If I happen to work with the same person on another day,
Yeah.
I'll ask, please, the other day you told me that I didn't do well. I appreciate that so much, and I tried to improve on it today. How do you see my performance? I do this because I don't want a situation where within my 6 or 12 weeks you come and tell me that I failed, and why did I fail? Because I didn't work on the things that you told me to work on. So that is one way that I use to track my progress to see if I was, progressing very well. Yeah, there were a lot of things, but these are the major stuff that I'd like to touch on.
Wow, wow, this was so good. Thank you so much. This is a very good information, Nathan. Sandra, I know you're also ready for me. I know from the from your own perspective, being a midwife. Okay, how did you go through this adaptation successfully? Yeah, so I know that definitely your clinical setting back home as a midwife is different from that of what you came to meet in Galway University. What are some of the
Yeah.
challenges? How did you solve it? Just to encourage other people also looking up to you.
Okay. So just like what Nathan said, my first challenge was the language. And it's not like I don't know how to speak English or I don't understand English, but it's like they are very fast when they are speaking. If you don't take your time, you wouldn't even hear pain. So my first time I went on the ward, my preceptor was like, I should check someone's vital sign. They call it up. And I said to myself, what did she say? Because I didn't hear anything. So I
Yeah.
went back to ask her what she said. So I think how I overcame this challenge was that I try to imitate them. Yes, I try to. So sometimes you find me on the word speaking to myself. I'm not speaking to myself. I'm trying to imitate what she said so that
Yeah.
I can speak like or similarly to how she speaks. Because if you
Hmm.
don't speak like that, some of the clients they don't get what you say. They're
Yeah.
always like, "Come in, huh?" Okay. So that's how I overcame my that challenge. And then the long hours in
Okay.
Ghana, we do from 8 to 2. But here we have long days, which is half seven, 7:30 to 8. And
Yeah.
my friend, I felt like collapsing on the ward because I was like, I'm tired. And my eyes were very, like I felt like sleeping all the time. It wasn't easy. But then what I did to overcome that challenge was that immediately I go on break, I try to relax a bit because we have breaks in between. We have our first break and our second break, which is the
Yeah.
lunchtime. So I make sure I finish my food early, then sit down for a while before I go back. Because if I don't do that, I can't survive. So the long hours was the challenge to me. And mine too was working with different preceptors during my first week. I didn't get the chance to work with my preceptor all the time for the first week. So working with different people, they had different ways of doing their things, and you
Okay.
have to learn what your preceptor is doing.
Okay.
So if this one teaches you this, the next person will also say, I do it this way. So
Yeah.
I kind of found it very difficult. But
Yeah.
what I to overcome that challenge was that okay, if I'm working with you, I'll do what you are supposed like what I'm supposed to do with you, what you like. And if I'm working with this person, I'll do what this person likes. And this also helps me to learn different things from different people. So those were some of my challenges, but the long hours, it was too much. Yeah,
That's good.
thank you.
That's good. That's good. Okay. Thank you so much, Sandra. That was very beautiful. Wendy, I know that now you're in a community setting, and back
Yeah.
home you're in the hospital. No, so what were some of the challenges that you equally faced coming from the hospital
Okay.
setting into the community
Community
setting?
setting. Yeah.
Yes.
So, unlike the hospital where you've got other staff with you, you've got the whole team. So nurses, doctors, like everybody's there to help in case things go out of hand. In the community setting, you're alone. Like whatever you are doing, you need to make sure you're doing it right because you're alone. You are with a kid and something is happening. You need to think fast and then know what to do or the next step to take before it escalates to something else. So that's the difference. So it's a bit tough in a community setting, unlike the hospital setting, because you've got the whole team there to back you up in case something goes wrong. But here, you need to be extra careful in everything you do so things don't go wrong for you. So basically,
Wow.
that's it. Yeah.
So do you miss the clinical setting, like being in the hospital? Do you miss it?
Oh no, I'm my own boss, so I like it there.
Wow. I enjoy that. You are your own boss.
Take-
Yeah.
yeah, taking the decisions myself, like doing things right. Like I love it.
Wow. Wow.
Yeah.
Wow. Abna,
Yes. Yeah.
anything to tell us how you are coping now, comparing the
Oh,
psychiatric back home and the psychiatric in Ireland? How this is between both
okay.
of us because I'm a psychiatric nurse, you're a
Yeah.
psychiatric nurse. So tell me, what are some
Okay.
of the challenges you also faced? How are you able to cope
Oh,
with it?
I think my first challenge has to do with the long hours. my first day, my first day at work. Oh my god, I go home and my feet were hurting. Guys, when you are coming, make sure you get comfortable sneakers.
Wow.
But I love the work. And then back home when I was in Ghana, I was in the community setting. So
Yeah.
over here, I am in a mental health facility that has acute and rehabilitation. So today you may be at the acute side, you may be taken to the rehabilitation side, but any of the centers, any of it has its workload. There is more workload at the acute side. The rehabilitation side, the workload is a bit less, but I'm enjoying it because so far the other nurses, they are very cool to work with. My only problem is the Irish English.
Oh wow. I
Sometimes
know, right?
I have
The accent.
I have a PIC. I have a PIC when I'm on duty with him. He is a typical Irish, and he
Wow.
always wants to be talking to you. And sometimes I keep nodding my head. Really? Oh, okay. Me, I don't understand what you're saying. Deep. I think problem. But another good thing about my facility is there are more African nurses. There are more African nurses. It makes you feel like that kind of settle with your people back home. But I'm enjoying it.
Wow.
For me, coming from a hospital setting and now finding myself in an acute setting and a rehabilitation, it's a learning. I'm still learning, and I know there's a time I'll be moving into forensic psychiatry where I'll be working. So here a probation place for me.
Yeah.
So I have a lot to learn. Yeah, rehabilitation, acute setting, and then to forensic psychiatric. It's an interesting thing that I really want to learn. So I was very glad when I had that in my contract that I'll be moving to a
You'll be
forensic
moving to
psychiatric
the
setting.
forensic.
So
Wow.
yeah, yes, I can't wait to get to that
That's
facility.
it.
I
Wow.
really am
Wow.
waiting for that. Yeah.
Wow, so proud of you, so proud of you. Thank you so much, Abuna. Okay, now let's move on to the next question, which I'll be throwing to Wendy. Wendy, when it comes to the RCSI website, we know that we have the RCSI website that is there to help guide nurses that are preparing for their RCSI or adaptation. It's not just for RCSI, but it's for all divisions. We are all supposed to get used and also be able to maneuver when it comes to the site and learn more about some of the things that we are going to use when we come over as to practice as nurses here. How are you able to? I want you to take us through how we are able to make use of the site. Some of the tips. Some people get there and the informations are lost. They don't even know where to even start from, what to do. How were you able to maneuver on the site?
Right. Oh,
Sorry.
okay. So with the RCSI, we have 14 stations. Yeah.
Yeah.
And when you go on the site, it's bulky and then you might get confused like, where do I start from? Where do I end? And all. So the 14 stations, I would advise you group them. So under this station, let's say you've got chest infection station. So go on the site, anything under chest infection, you read it. Then you go to this another station, let's say sepsis. Sepsis is a main station on its own, so you've got fewer things there. Then you read that as well. So when you group it, it makes it easier for you. But when you are going according to what it's on the site directly, because some start from respiration, then you go to cardio, then you go, like it becomes so confusing, and then you might end up being confused on the whole thing. So when you group it, it actually helps with it. And then you wouldn't say you're only reading, you've got the practical aspect as well. So you need to practice. I would actually encourage you to practice because that's what helped. The more you practice, the more it becomes easier for you. You might know it off head, but if you've not practiced it enough and then you get to the station, let's say wind dressing, okay, this your sterile field, this your clean field, and then you are crossing your hands. Unknowingly, you are doing it, but it might be going against you because you end up failing that station. But the more you practice, the more you like get to know of it or become so conscious of what you are doing that I'm not supposed to cross my hand. I'm not supposed to move things from the clean field to the sterile field, else I'm contaminating my whole stuff. That kind of thing. So practice, 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 and then I would encourage people to go on the website daily because they keep updating it. You might not know. Maybe what you have in mind or what you've been reading on, it has been updated and then you've not had any idea of it. Get to the example and then find out that like things have changed for you. So group it, practice, and then keep going to the website for any new updates. That's all I have to say about that.
Wow, wow. That is so informative. Thank you so much, Wendy. Abuna, can you tell us more about I know that we have a lot of psychiatric nurses here, and I know that some of the stations are just like the general stations, and we have pure psychiatric stations as well. How can you educate someone or encourage someone, kind of guide the person on how to also make use of the website for the RCSI as well?
Okay, so basically, you for the psychiatric side, you'll be entering 12 stations, but at the end of it all, you complete 14 stations, and because two stations are linked station, there are two linked stations. So those two linked stations, you do two procedures in one station, which is counted as two. So that makes it 12 stations but 14 procedures. So basically, and there are strictly psychiatric ones. There are few, I think there are about 5 or 6 stations that are related to the general nursing, which obviously you can practice with the general nurses to get your hands more on it. But the rest are strictly psychiatry, and you need not to joke with whatever you are doing back home. If you are in the community setting and you are closer to any of the acute facilities, I will advise you, make time once a while, go there, try and upgrade yourself, because the OSCE psychiatric stations were strictly the things we were doing back at Anchor for Pantai and Aqua Mental. You are going to meet them. You are going to meet a patient who is panicking, and your task is to de-escalate the panic attack. You will see an aggressive patient, and your task is to de-escalate the aggression. Use SBAT to communicate to the consultant psychiatrist, using the Mental Health Act 2001 of the Ireland. It's a whole thing. The best you can do is try and connect with people. Since we were the first group, now the second batch, you are lucky to have us. There are some of the information which were not so much explained on the website. They just give you the basis on the website. But now that we have taken it and now we know the full details of the psychiatric stages, if you are preparing for it, please get in touch with us. Let us give you the full psychiatric stations. Some are on the page, on the website, but not well explained. So it is up to you to find those information. Whilst you are preparing from the website, try and connect with us. Connect with anybody to help you. It is a very simple stations. Trust me, I enjoyed the
Yeah.
stations because they were so interesting. But if you are not prepared for it, it will be difficult for you. So
Yeah.
please connect, connect, connect. Me, that's all I can say. Connect. Prepare, like be in groups and be practicing. How do you de-escalate panic attack? How do you de-escalate aggression? How do you conduct mental state examination? How do you
Mm-hmm.
conduct psychosocial examination? How do you do clinical risk assessment? Camberwell needs everything is on the website, but practically you need to connect and be practicing among yourself, because the website is not demonstrating how you are going to do it. They've only
Yeah.
given you the information, so it is up to you to find the resources. And that is why
Yeah.
you are fortunate to have us. With that, we didn't have any people to rely on. Now you
Yeah.
have us. Connect, know how the station goes. Trust me, they were very simple, but if you are not prepared, it can, I mean, it will wrap you up. So you need
Yeah.
to
Yeah.
prepare well. They were very interesting station. I always say that I loved the psychiatric station because trust me, it was full of drama. You know how our patients react.
Yeah.
Full of drama. It was interesting. Just get your psychiatric, links and competencies on your fingertips, and you'll be able to sail through. Very simple. Everything on their website is very important for your preparation. If you have any psychiatric RCSI offer, do not joke with the website. Always go there and make sure that any video on the website, watch it. Any instrument they have displayed on the website, make sure you learn how to use it. Go on YouTube, connect with the general nurses, connect with the
Yeah.
pediatric nurses who have already gone through, and you get the necessary support. It's very easy, trust me. The psychiatric OSCE, it was very interesting, easy to pass and easy to fail if you don't prepare. That's all I
Thank
can
you.
say.
Thank you. That was powerful. Easy to pass and easy to equally fail. I'll just want to add a few. As Abna was talking, she's saying that connect, connect, connect with us. I know most of you will be asking, how do I connect with my nurses? The easiest way to connect with us is that I'm going to drop the link to my Telegram group at the description button after this session. Okay, and then when you check other videos of mine, I have the link to my Telegram page. You can equally join. Don't worry if you don't have your RCS, if you don't have your OET or your IELTS exams, you can equally join. If you have any question, you can ask us. If you have now passed, we can also add you to a platform of nurses that are all on the same journey. Then we can also offer any kind of help that we have for you. Thank you so much, Abuna. Thank you so much. Nathan, I want to find out. I know that you did adaptation in Ireland. However, I know that you were very active when it comes to RCSI. What are some of the stations that you really found beneficial to your adaptation? Or how were you able to also really learn that RCSI? What advice you have for our viewers?
Yeah, so what I would say is that the moment you are making an effort to leave Ghana, and Ireland is the destination you're targeting, just make it in your mind that it is RCSI you're coming to write, because uh, you don't even know which job you will be getting, whether the company will be giving you the option to do RCSI or the option to do adaptation. And so that was the mentality I adopted. It got to a point in time when I had my contract, I knew that it was adaptation I was going to do, but still, I just still continued studying as if I was going to write the exam. Like I mentioned earlier on, if you know how things are done here, when you come, despite all the cultural shock, the change in time and environment, and all the things that your body is now trying to adjust to, you already having a pre knowledge of how things are done helps you to settle in easier. Because literally everything that you do in the RCSI preparation is the same things that we do on the ward. The tools that are used, grading, score, whatever, like everything is literally the same. Now, I would also like to say that the reason why I would advise you to be joining the RCSI classes or the preparation is that when you secure an interview, they ask you questions as if you are already an Irish nurse. They might present scenarios to you during your interview, and then probably they tell you that the person has a grading score of 13 or 12. And then within that scenario, they expect you to do, an assessment on the patient. If you don't have a pre-knowledge of what that score means, how then are you able to respond to that question within your interview? You might end up failing. They don't assume that you're coming from another country, and so they will ask you the questions based on how you do things in your country. No. So I would encourage everybody who is planning to come to Ireland, that learn as if it is RCSI you're coming to do. When you get your contract and adaptation, it's good. It even makes you, extra smart, because when you get here, you are already a step ahead of your colleagues who don't probably know much about how things work here. So that's the advice I would give to everybody. And one other thing is that bear it in mind, time moves here very fast. And so if you're thinking that when I get here, this is the time that I'm coming to learn, you are deceiving yourself. The time for you to learn is back home. And if you're waiting for you to get your contract, the time you get your contract and then you flying here, you wouldn't be so much settled. This person will be calling you, send me this document, you're traveling to secure your visa and all that. You wouldn't have peace of mind to study at that time. Now is the time for you to study. If you know where you're going, then just start doing the preparation so that you wouldn't come and mess yourself up. So that's my little, thing.
Oh, thank you so much, Nathan. Thank you so much. Sandra, when it comes to your midwifery, what are some of the stations that you find very helpful during adaptation? Would you say all the midwives should equally go on the website and then make sure that they get used to each and every station, or would you say they should just learn what's your, from your own experience? What is your advice to that?
Okay. So from my own experience, beginning, like initially, I didn't take the RCSI stations very seriously. In fact, I wasn't even following the classes because I felt like it wasn't a part of my adaptation or midwifery course. So when I came here and I realized that it's kind of related, I was like, huh, I should have learned these things. So my advice to all the midwives is please follow the RCSI classes or go on the website and like read it, have a fair knowledge about it. And so when you find them on the ward, you wouldn't be found wanting because beginning I found it like really difficult. And
Yeah.
I was like, I had known like something little about these stations, I would have found it very easy to go like along with.
Okay.
But little, small, I'm trying to
Yeah.
learn them and integrate it into my practice. Yeah.
Okay, so from your experience, you're going to advise our fellow midwives to also take RCSI equally important, and also make sure that they also get used to the stations on the the RCSI website, because
Yeah.
they are the same things that you're also going to practice.
Yeah. Yeah.
Okay. Because I
RCSI
know that
website.
most of the midwives and the psychiatric nurses usually are, oh, I just want adaptation, so no need for me to learn RCSI. I know most people usually like to say that a lot, but it's equally very, very much important. I think from my own experience, I know that it's very, very important for us to know each and every station, because you're going to use everything that you learn on the website on the
Yeah.
your final day. Okay, yes,
Yeah.
that's how I'll say it, on your final day. So it's very, very, very important.
Yeah. The website is very important, so everybody should visit it and learn something.
Wow, wow. Thank you so much. Wande, can you give us Let me go to Nathan. I just want to say a little bit about adaptation. Nathan, I know that when it comes to adaptation, you have a whole 6 to 12 weeks to complete your adaptation. I know you've said a lot. Okay, can you give us some few tips, some things that people can, they should have at their fingertips during the adaptation?
Okay. I will try to be very broad in this
Okay.
situation. One, the work environment here is highly organized, and if you find yourself in a specialist environment, you will be required to go deeper. So that is one thing we need to keep in mind. The environment is fast paced. Everybody is walking fast. Everybody is talking fast. So if you're the slow kind of person, like in terms of talking, in terms of writing, here we don't even write, we type. So if you know that you're very slow, this is the time for you to start working on your talking speed, your typing speed, all those things. The environment is made of a lot of multinationals, and you are required to work with everybody in an open, manner. So if you're the type who has issues with people, you will start to, you need to start working on your people relation skills. Exactly. There is so much emphasis on documentation,
Okay.
and everything you do needs to be documented. And so let's also bear that in mind that documentation is going to form an integral part of our service delivery here. And contrary to what most of us are used to, back home, we are used to individual nursing. Okay, I'm taking from bed 1 to bed 10. Here, it's team nursing.
Yeah.
And one thing that you would realize is that communication is central, because maybe somebody did a procedure on a patient, then you also go because the person didn't tell you, or because you didn't tell the other person, the person also sets up the trolley and goes to the same patient. You are disturbing the patient. It also tells the patient that you are not highly skilled, you are not good at communication,
Yeah.
and you're wasting time as well because you're all duplicating effort. So these are the essential things. And you shouldn't have it in mind that I'm sorry, this is a very sensitive issue, but I have to touch on it. That the issue of racism, whether there is racism or not, you are here to work.
Yeah.
I would like to say that in every population, we have extremists.
Yeah.
When you come to Ghana, you have extremists who are also racist in Ghana. That is not your business.
Yeah.
The business is to come to work and make sure that your human relation skills are good. If you are so good in relating with your patients and other staff, the opinion of one person will not be so strong enough to fail you. So make sure you are all around. People know you are a nice person, and you are good, technically good with your job, and you wouldn't have any issues. And areas that you yourself you identify that I'm not so good with this procedure or with this. When you go home, go to YouTube, or maybe you can print out the procedures on that. The good thing is there is a procedure, like a protocol for everything here.
Yeah.
So you can always print out those protocols, and then when you go home or on your off days, you read those things. It's much more easier to pass adaptation if you're able to work on yourself and seek daily updates or
Okay.
feedbacks from your professors. Yeah, so those are the small things I'd like to mention.
Thank you so much, Nathan. Thank you. Sandra, any tips from you as a midwife? Any tips from you that you want to give to your fellow midwives?
Okay, like on how to prepare for the adaptation.
Yeah. And even during the adaptation, some of the things that some of the things that you really used that was really beneficial to you.
Okay. So, first of all, before coming here, you'll be given some online courses to complete. We had the HS Land course and the K2 course. And so I'd like to encourage all my midwives that when you get all those courses, make sure to complete all of them and not just read through them, but like take notice of all the courses because they are the same things that are done here. And the K2 especially, you have your CPG there, and here they use the CPG a lot. If you don't know anything about CPG, that's the best time to learn about it so that when you come here, you wouldn't be found wanting. And when you're here too, they have computers all around the world. What I do, especially when I get a little bit of time, is that some of the drugs that I don't know, which some of them they use different names, so you think like I don't know this drug. So what I do is I go on the computer, then I Google it to know something about it.
Yeah.
So yes, I use their computer and the Google search, and also after every shift, one thing someone I learned from someone is that if you want to know that maybe you are doing something for someone and if you want to know whether the person acknowledges it or whether to know your fault or your mistake, you have to ask for a feedback. So that has been behind my head, like literally translation. So what I do is that after every shift I ask my preceptors like any feedback, any mistakes, what to work on. And then when they give it to me, I make sure that the next day I don't repeat the same thing, like I work on it. So yes, feedback is important and make sure you use the computers all around, the Google Chrome, search, 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 search. And they have policies on the computers too. And basically that's what they use to work on the women there. So they have policies on maybe baby bath or breastfeeding. You have to read through those policies, and then that's how you can work on your women. So it though it's different from we being in our house, sorry, in our country, Ghana. But when you get their policies and you read through, it becomes easy for you to get feedback. And also, as a midwife, we do a lot. So I'd like to encourage some of my midwives that make sure that you always get a small pad. So I have a writing pad that I always put in my pocket. So whatever my preceptor says and I don't understand or I want to find more about it or research more about it, I jot it down. When I come home, I go through them because that's the easiest way for me to learn. So, yeah, basically that's all.
Sandra, that was very powerful and very informative. Thank you so much. I know that we've already done 1 hour, so it will be time for us to take some questions. And I believe that from the questions, then we can equally answer that. It would equally help us answer some things that we're about to talk about. So I'll go through. Let me project everyone so we can all have a feel. It's not just for Sandra; we can all have a feel of it. So I'll just go through each and every question, and then I'll try and answer the ones that I can. And then if there are other ones that I have to put to you guys, I'll definitely do that. Um, so the last person that I actually ended on was we had from Faith. Faith says, "What is CCPS?" Okay, so I saw that Nanayao, my coach, already answered that. That's Certificate of Current Professional Status. So you get that from your nursing council, please. You are supposed to get that from your nursing council. Your nursing council will send that to NMBI to say that you've during your practice you've been of good behavior, or it just basically tells them if you've been of good behavior or you haven't been of good behavior. So that's what the certificate of current professional status is all about. So it's just like a verification and all that. And then Faith actually understood that. Thank you, Victor. Victor is also a coach on my Telegram page. He's also a brother. He's been very, very great, helpful. Victor, big ups to you and congratulations to you because Victor is also an Irish nurse now. He completed with Nathan in the same hospital. So, Victor, congratulations to you and also to Sandra. Congratulations. Actually, congratulations to all of us. And then we have Mate says, great updates from you guys. Thank you so much, Mate. Really appreciate you. Frank Lord says, I see you, Nathan. Frank, thank you. We can also see you. And then we have Joy Ofu says, Nes Abuna, I see you. Abuna, people can see you, pa. And then Sandra Prisla is also saying she really enjoys your Irish accent. Thank you, Prisla. We really appreciate it. And then Akwaba says, Nes Abuna, I can see you. Thank you. And then we have Angelina. Everyone keeps saying CCPS. I believe I've already touched that, so I wouldn't say much. And then we have Kezia says, very insightful. Well done. Thank you so much, Kezia. That is the main reason why we are having this session, so that we show more light and insight into what adaptation and RCSI is. So we are very grateful that this has been very helpful to each and every viewer today. The same CCPS. I'll try and skip all the questions about CCPS because I believe I've already answered that as well. So we have Faith. Faith says, for general nurses, what determines whether to do RCSI or adaptation, and do we pay for it ourselves or it is sponsored? So Wendy, I'll give this to you, then you can take us through.
So for general nurses, yeah. For general nurses, it depends on the hospital you're going to work for. So they
Yeah.
will determine if they want you to do adaptation or LCSI. And
Yes.
it also depends on the hospital. Some HSC hospitals makes you pay for your own stuff and then later reimburse it to you. Some to pay for you and then like you just come in and do it.
Okay,
So
okay.
that's it. Yeah.
So, Faith, I believe that has been answered beautifully. Thank you so much. Bendy says, so with adaptation, are we supposed to come with our scraps or will the facility provide? So, Nathan, can you help us with that, please?
Situation, I requested for a picture of what uniform they use, and he sent me a picture. So I see my own uniforms back home before getting here. The truth is, the uniforms here are very expensive. So it's ideal for you to just request and see how the uniform looks like. And so similar thing from home before you come.
Nathan, can you take that again, please?
Yeah, so I was saying that it ideally you can request from your HR for them to send
Okay.
you a picture of the uniform they use, and then you can sew it from home before coming here because the uniforms here are very expensive.
Okay, okay. Thank you. And also, I'll just add a little bit for my experience. Actually, with my hospital, they also provided the tunic for us, and then we only had to bring in the trousers, which was the black trousers. If you are a psych nurse and you find yourself at the rehab unit, you might not even wear uniform. So it depends. It's very important that you find out from the HR if you need to get a uniform or you are going to wear your house attire as well. So that's very
And
important.
like, I'd like to
Yeah.
add, for the midwives, those working at the postnatal and antenatal, they will send you the design for your work attire. But with the labor ward, they provide them with scraps. So labor ward, they wear scraps. Then antenatal, postnatal, we sew our own uniform. Yeah.
Wow. Thank you so much. Abuna, when it comes to your side, what's your experience with that?
Okay, for uniform aspects, for my facility, we don't uniform because psychiatric setting, we have so many aspects dealing with stigmatization and all that. So we don't wear uniform in the setting. But when you're going in RCS, you are supposed to be in a scrub. So the hospital advises you in the scrub. There is no specific scrub uniform for the RCSI exams. All the policy is you are in your scrub uniform, in sneakers. The sneakers can be of any color, but I think probably black. So, workplace can be in any very smart, comfortable sneakers. So basically, for where I work for the psychiatric setting, we don't wear uniform.
You don't wear
I
uniform.
love that.
Yeah, yeah, I do. I'm actually at work now. I've actually closed. Let me say I've closed, but that's my attire for today. Yes. So we have from Andy. Andy says, so how many days do you work in a week? Okay, I think Abna, you can take us through this one since
Okay.
I'm already.
All right.
Yeah.
So okay, so for instance, you're supposed to work for I think 14 days in a month. So there are depending on your hours, we work 12 hours a shift. So if for instance you go 3 days this week, next week you go for 4 days, the following week you
Okay.
go 3 days. So it's 3 days duty, 4 days off. The following
Yeah.
week you go 4 days duty, 3 days off. So that's how my setting, that's how we run our shifts.
Awesome, awesome. Wendy, when it comes to your side, I know that you're in the community side. How is your schedule like?
Okay, so per the contract, I'm supposed to do 40 hours per week. We do it
Okay,
per hours, yes. And with mine, it's not 12 hours, it's 10 hours. And with some clients, you have 9.5 hours.
okay.
So I sometimes do 4 days in a week. Most of the times I do 4 days in a week, but you can always opt for extra days, like for more cash, We are here for the money.
Yeah, for the cash, you're here for the money.
Yeah.
Nathan, is it the same as your hospital when it comes to the shift system?
So, my place, the contract says you're supposed to do 37.5. Most of the time, I do 3 days in a week.
3 days in a week.
Wow.
Yeah.
Oh, okay. Wow. You are able to meet up with that hours.
Oh, yeah.
Okay. 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 I believe it's the same for Sandra when it comes to the HSC. It's the same. Okay. Okay. Thank you. Let me take the next question. The next question say, kindly explain what's the first step to take after completing OET, which documents to upload. Okay. This is from Sophia. Sophia, no, sorry, this is from Faith. Faith, kindly check my videos about the step-to-step process when it comes to the Ireland journey. And I also have a video about the NMB, a relevant document to upload on your NMBI portal. So please, after the session, kindly check all my videos, and you are going to have all the information on that as well. Thank you. The next question is from Sophia. So what is the cost when it comes to RCSI for midwives? And is it self-sponsored or does the facility does during the period of stay? Sandra, if you would like to take that.
Okay.
Can you unmute yourself? Yes, thank you.
For midwives, we normally don't do RCSI, we do adaptation. But I was advising and encouraging that some of the thinking in RCSI is kind of related to midwifery. So it would be good to know something about it from the website. And yeah, so it's basically adaptation. I don't know of RCSI. None of I've heard of.
Yeah, so Sandra is right. When it comes to the midwives, your decision letter that you are going to receive is mainly going to be for only adaptation. Currently, for the RCSI, it's just for general nurses and also psychiatric nurses. So I think the psychiatric nurses, that for the psychiatric nurses was introduced, I think this year.
Last year, and it was taken this
Last
year.
year. Yes. So for midwives, it's only adaptation. Okay. Yes. Thank you. And then we have Josephine says, please, for general nurses, will you be given the option to choose between the aptitude test and the adaptation, or the aptitude test is compulsory for general nurses? Nathan, can you take us through that?
Yeah. So I think Wendy touched a bit on that. But the point is, NMBI has listed a number of hospitals that are approved as adaptation hospitals. So it depends on, if you go to the website, you'll be able to see those hospitals listed. So if you are happening to get any of those hospitals, then you know that the possibility that you will do adaptation there is very high. But if you're not getting any of those hospitals, there are situations where certain agencies would let you do adaptation in those hospitals, and when you're done, they send you to your clinical area. So that variance is also there. So it all depends on the contract you get. If you get a contract with an adaptation hospital, then you will do adaptation. But other than that, the probability that you'll be doing RCSI is very high.
Thank you so much, Nathan. We have Sophia. Sophia says, Nurse Momo, please, can you bring public health nurses and community health nurses on board so that they can also share their experience with us? Thank you so much, Sophia. I really appreciate this suggestion. I actually want more suggestions from you guys when it comes to our live sessions. If you have anything that you want us to really come live and talk about, kindly post it. I'll definitely put all down in my diary and I'll work towards that. Thank you so much, Sophia. And then we have Joy. Joy says, please, can you address this red list issue? Thank you so much, Joy. When it comes to the red list, currently I'll not be able to say much about the red list. We are still in contact and then waiting on NMBI if they have anything to say in regards to saying. I know some people have also received some emails from some agencies. However, we are still waiting for the news from the right people that we can now say that it's going to affect Ireland or not. So I'll excuse this comment because I can't really say much. I'm actually also waiting for news from other people, just as I said. Yes. Faith says, can we relocate as healthcare assistants, then later to nursing when in Ireland? Yes, Faith, you can equally do that. The most important thing is that you have to talk to your employer. Let them know your plans for the future. Because if someone is bringing you in as a healthcare assistant, maybe they have shortage for healthcare assistants, and they want to do that for the long term. Okay, so if you want to later convert into a nurse, you should ask them if they are okay with that. If they really want you to come in, work as a healthcare assistant, and later you can now convert. I believe that if they are good with that, they will definitely accept it. If they have any concerns with that, they are going to address it as well. Because I know some nurses that came in as healthcare assistants and their employers are happy to have them write the RCSI or the adaptation so they can equally convert. So please, it is very doable. Thank you. Victor Dansu says, any crash for Nathan this evening? Victor, really? Thank you so much. All work and no play. It's accepted. It's accepted. So Dinah says, next one, I just received a mail from Servisos about the red list, the WHO red list, and hold on recruitment. What should I do? Please help a sister. Just as I addressed it, this is from Servisos. Let's hold on and see if NMBI is also going to issue any kind of statement, or we are going to hear something formal. Then we can now base our response on that. But currently, my hands are tied. I'll not be able to really mention anything or say much about this question. Thank you so much, Diana. Please stay tuned. I believe that I'll be releasing a video on this soon when I have all the information that I really need, because I just don't want to come out just to say anything. We have to be very skeptical and very careful about what we say in public. Thank you. And then we have, I think someone was complaining. Okay, so Victor says you can do a direct application to the hospitals. He's advising you, and I think that's going to be very, very helpful. And then Faith says, how is adaptation or RCSI for the nursing homes? Do we have anybody in the nursing home here? No. So when it comes to the nursing home, most of the nursing homes prefer the RCSI because most of them are not able to meet the criteria for adaptation. So they always have their candidates going in for RCSI, which is the two parts, just as Wendy, Nathan, and Abna explained. Yes. And then we have, hi, sorry, this was actually for me. And then we have Yepua. Yepua says, how long does a decision letter usually take from NMBI? Okay, this is a very interesting question. So mine actually took 8 months for me to receive my decision letter. Nathan, how long did yours take?
It took 8 months.
8 months, wow. Okay,
Yeah.
Wendy, how long did your decision letter take? Okay, I think you. Okay, let me unmute. Yeah.
6 months.
6 months. Wow. Okay. Sandra, how long did yours take?
7 months.
7 months. 7 months. Okay, Abana?
5 weeks.
5 weeks. Yes, Abana was part of the new people.
Yeah.
Okay, guys, that is the good news. That is the good news.
We were there. I mean, was it God's favor?
Thank you, Abana. Yes, it was God's favor.
EAR in 3 days.
Wow.
And then decision letter in the
Wow.
following year.
Wow. Yes, that is the good news now. That is the good news now. Now, NMBI has actually put in place lots of structures, and when it comes to the overseas recognition, things are very smooth. So I encourage each and everyone, you don't have to worry. And then just as people were complaining last year, that the process is very tedious, it takes a very long time. When it comes to a decision letter, please now go for it because it's not that tedious or as last year. Yes, thank you so much, Abna. Thank you in 5 weeks. Well done. Then we have Faith says, thank you so much for staying there. Thank you for connecting. Thank you for all the questions. I'm really enjoying this from you. Please stay connected and can continue sharing this video with your friends as well. And then how many attempts are given for the RCSI stroke adaptation? Wendy, can you help us with that? So I'll have Wendy and then, yes.
Okay, so with the RCSI, you have only 2 attempts, the first and then the last. So you need to
Okay.
put in all your efforts, because when you don't make it the first time, it's depressing, knowing that you are left with just one last chance to make it. So you only have two, unlike UK where you have three and all that. This is just two.
Oh, okay. Thank you so much. Yao says, hi, can we have the link to the RCSI page? Please, if you Victor and Nanaya or Sekina, please, if you are here with us, if you can help us drop the link. However, if you are not able to drop the link, I'm definitely going to drop the link at the description button when we are all done with this today's session as well. And then we had Bismarck. Bismarck say, well done, Nathan. Well done, Nathan, for helping all of us. And then we have Yebua. Yebua says, what are some of the things that makes people feel adaptation? Wow, that is a good question. So I'm actually going to take this from Nathan and then Sandra briefly.
Well, hmm, I don't want to sound some way, but we know that in every team, if you are loved by your team members, people would want to have you around. You should just read meaning into that. So one thing is that you should make sure you're liked by your team members. Aside that, there are a number of things: your communication, your time management, how you assess patients. Make sure that you don't put patients at risk. For example, your safety checks that you do every day, your pressure alter, what we call grading score, false assessment, all those things. I remember that I was having a talk with one of my preceptors, and when he made mention of extension, and I went to ask that, why are we doing it? And she's like, oh, I shouldn't worry. So long as I wasn't called anywhere to a meeting that my conduct puts patients at risk, then I shouldn't worry. I'm in safe hands. So it means that is one of the major things they look out for.
Okay.
If your practice puts patients at risk,
Okay.
it looks like you will not be able to make it. So, well, that's all I have to say about that.
So you should say that you should know your staff as a nurse. You should know what you're
Exactly.
doing.
Exactly.
Okay. Okay, Sandra, what would you have anything to say about this when it comes to what makes people feel adaptation? Anything you want to share with our fellow nurses online with us?
Okay. Instead of me saying what makes you fail, I'll address what will make you pass.
Okay, thank
So
you.
first of all, know that you are with God. No, God is with you.
Thank
So
you.
involve God in everything you do. Involve Him. Speak to Him, talk to
Yeah,
Him. So
most level
prayer is
education.
practice. Yeah. And then what they actually look out for most of the time is how you communicate with the clients or the women there. So
Okay.
your first thing should be your communication. You need to communicate well, and it's not like they go inside, speak for like some seconds and come out. No, it's like you are actually talking to your friends, like asking, probing further. So your communication skills should be good with both the clients and also your staff members, those you work with. And also make sure that whatever your preceptor tells you to do, if you don't understand it, just ask again, and she would repeat it back to you for you to get it clear. And also follow everything she does. If she's going somewhere, follow her until she say, unless she says, "Oh wait, I'm coming," because if you're doing that, you know that you want to earn more. So everywhere she goes, follow her.
Yeah.
And anything she does, make sure you are involved in it. Ask a lot of questions and
Yeah.
also ask for feedback, as I said, and let her know that you are ready, like really ready to learn and relearn, because adaptation is all about you learning and relearning everything. And ask questions, like ask a lot of questions. Print their policies, learn them, and make sure you know you have fair knowledge about whatever is done on the ward. Because if you are there and you don't know anything, like you don't even understand what is done on the ward, then maybe they will be like, "What are you doing here?" Yeah, so I
Yes.
think these are
Yes.
the things. And My NNDI process took 4 months, not 7 months. Thank you.
4 months. Thank you for the clarification, Sandra. Thank you so much. I think
I
I'll
would
just
like to say something
yeah.
to that. Sometimes when you're in the world and you don't know something like how it is done in your new setting, don't just go and ask, please, I don't know how this is done. If you do it that way, they see you as an empty-headed person. So you should go and be like, I, I know this is how we do it, but then can you tell me how you do it in this world? That
Okay.
way, the person knows that, oh, I'm dealing with a level-headed person and not some
Yeah.
ignorant who is just,
Yes.
wandering around.
That is
Yeah,
powerful.
so
That is
totally.
powerful. That is powerful. Thank you so much, Nathan. I'll only share a few because I equally did adaptation, and I believe that I can also share a few from my own experience. I would say that one thing that really I'll always tell people that when you go to the world, be confident. Okay, being confident does not mean that you should let things get into your head and try to prove a point that you know everything from where you're coming from, and then you can do everything. Being confident is different from trying to show off. Being confident in the essence that when you are asked to do something, don't try to shy away from some of the duties on the ward. In an instance where you are given an opportunity to write a note, don't tell them, oh, because I just came in, I'm not ready to write a note and all that. Oh, at least when they tell you to hand over, give it a shot. You to try and do something. Let them know that indeed you know how to give a handover back home before you came to their country. And apart from that, I always tell people that when you go to a clinical setting, it's very important for you to have a very good interpersonal relationship with your patients and also the nurses. Okay, don't let it look like someone is out there to get you, because it's never like that. Most of the Irish people are very nice people. I know it's not 100%, but no, most of them are really willing to really help lots of us. Okay, so let's have a very good relationship with the staff and also the patient. Most importantly, the patient is very, very important. And then I'll say that per my experience, what I really did that really helped me is to get used to the clinical setting, their daily routine. Okay, I came in and then I saw lots of things being done each and every day. But I made it a point that, oh, this week I told them I'm just trying to get used to what is done every day. I'm just saying this from my own experience from the psychiatric side. Okay, so I got used to what is done every day. I actually had my own notebook. I wrote that down, and then I know that when I'm coming in on Monday, I know what anything at all can happen, but I know that there are some specific things that are done on the ward on those days. So nothing kind of caught me by surprise. And then I know what is done. I don't wait for anybody to tell us that it's time for medications. When it's time, I'm like, oh, my preceptor, it's time for medications. Can we go and serve medications? Those are some of the things that we should also make sure that we are used to. We are very much used to. However, if there are some procedures that they are not supposed to do, like serving of medication, please don't just go ahead and just serve medication. If you have any suggestion or anything at all that you really want to go forward and do, remember to discuss everything with your preceptor. Okay, everything that you are going to do. Remember, you are working on the clinical supervision. You are not there, you don't have your PIN yet. So make sure that everything that you do, you communicate with your preceptor. It's very, very, very important. And if you don't know how to do something, I know Nathan said this, but if you don't know how to operate a machine, or you don't know how to maybe perform any skill, or you don't have any certificate for it, please don't go ahead. Let the person know that I don't have training in this yet. Can you please take me through? And the next time, per your own supervision, I can also try. That is equally important, and it is accepted. So please, let's take note of these few things. It is very, very, very important. And I think that is all for now. In case I remember something else, I'm going to bring it up. Okay, so I'll be taking my next question. And from Miss Mohammed says, well done, guys. Let me bring all of us to the screen. It's not just me. Sorry, everybody can have a few of us. Yes. So it says, well done, guys. Thank you so much, Mohammed. Daniel says, is Ghana on the red list? So Ghana is on the red list as far as I'm concerned. When it comes to Ireland, I'm not too sure if it is also going to affect us. So in that regards, I can't explain that. And then we have Ruth. Ruth says, kudos, Sister Lucinda, great live session. Really love it. And thank you so much, Ruth. You've always been there. I've been seeing your comments on each and every video. Thank you so much. You guys really began with me from the very first day till now that we've actually closed over 2,000 subscribers, and I'm proud of each and every one of you. And then we have Caroline says, please, how is public health in Ireland? Have you come across any public health nurse? Please, where do they do the adaptation? Okay, so I've come across public health nurses in Ireland. I think most of them actually register under those I came across with under the general division, and also I've also seen someone who also had what's the general certificate. So the person registered under the general section before they did their second division in the public health sector. So please, if you have any connection with someone else, you can equally connect with me. I would love to post the person on my page as well. And then we have uh, Tommy Lanyo says, what's the allowance given during adaptation able to was the allowance given during your adaptation able to sustain you? Very, very important. When it comes to funds, it's very, very important. So Nathan and Sandra, was the allowance sustainable? This is a quick one.
I think it is. It's enough to take you. So yeah.
It's enough. It's enough. It is enough because every fortnight you are receiving. I think is it 1,000, 1,000 something.
Yes.
Please, you can
Yes.
go
And if
through.
you do some
Yeah.
social hours, you might get something extra on that.
Okay. Okay. So it is definitely enough. It's definitely enough. Caroline says thank you. Thank you so much, Caroline. We have someone. Someone says thank you very much for this information. Can you please mute us? Thank you. And then I'm a midwife. Please, where do I get the site to learn for adaptation? So we are going to post the link there. You can equally learn some of the things on the Rcsi side, which is equally going to help you. I'm also going to drop the link to my Telegram page on at the description. After I post the recorded session, you can equally join my Telegram page as well. We have a Telegram page for Ghanaian nurses alone. We have a Telegram page for African nurses, which is equally headed by a very lovely lady called Nurse Goodness, and she's really helping other people as well. We also have that for the Ghanaians. We also have a general page. So please find a way when you get to the to our Telegram page, which is a general one. If you have actually passed your English proficiency test, you are going to be added to these two pages as well. And then we have someone says, please, with adaptation, are we asked to perform delivery at parts of our OSCE? Sandra, okay, so there is nothing like OSCE, but I'll let her answer this based on adaptation. Are you given the opportunity to also perform delivery?
Yes, we are allowed to perform deliveries under supervision. So yes, we perform deliveries.
Thank you so much. Sophia I say thank you for the clarification. Thank you too. Faith says thank you so much, Nesmomo. You have cleared most of the mist around me. Be blessed with your team. Thank you. Please, you should all receive your blessings, not just me. And then we have Sophia Nesmomo. Can you please help with the healthcare assistant route as well? Sophia, please check my video on jobs in Ireland for healthcare assistants. I actually explain everything over there, so I won't say much, but please check that video. Just go through my playlist or my videos. You're going to see the video for that as well. And then we have Sophia Coleman, my big sister. She says, yay, I'm here. Thank you so much, Sister Sophia, for joining us. I'm really grateful. Thank you so much for your support. And then we have Matilda. Matilda says, interesting session. Keep it up. Thank you so much, Matilda. If you have any topic at all that you want us to talk about, please drop it in the comment section. I'll actually pick that up and we are going to plan that very well. Sophia says, Wendy has a beautiful voice. Wendy, they feel your beautiful voice. Oh. Let me see her face. She's already blushing. Okay. Frank says, sorry, I had someone before Frank. Well, say she's saying that AWS delay is stressing us. I know. Senyamo, I understand you that now. Oh shit. Yeah, so I know that things are kind of this delay now, but we are praying that things get very easy as time goes on. So please, let's be hopeful. And then we have Frank say, can you kindly get an explanation on the AWS delay thing that is happening? Wow. Okay, I'll try and see if I can talk to some recruiters and then find out the reason why the delay. If I get enough information, I'm very confident of it. Why not? I'll definitely share with you all. And then we have Faustina. Faustina says, keep the good work up, Nurse Momo. Thank you so much, Faustina. We are not backing out. We are the energy we started with this. We are actually going to go on without anyone stopping us. Thank you so much for also joining us and also encouraging us. We have Josephine. Josephine says, actually, I want to have all my guests with me on the screen, not just myself. And then we have Faustina says, no, Josephine says, I've really enjoyed this session. Can't wait to join you all. We can't wait to also meet you up at the airport and also meet you in person. Okay. If you want me to meet you at the airport, you can ask these guys. I met most of them. Just get in touch with me. I'll meet you at the airport. And then we have Faustina. Faustina says, shout out to Nurse Abuna. Nurse Abuna, shout out to you from Faustina. We have Moses. Moses says, is there any preparation period allowed before RCSI after one finally gets to Ireland? Can we get that from Abuna? Can you take that for us?
Okay, so basically, you don't know the sort of job offer you're going to receive. You don't know whether you're going to get RCSI or you're gonna get adaptation. So the best preparation period is the moment you submit your documents to NMBI. Start preparing for RCSI, because it can be that you get a job offer today and the next week your employer is booking your RCSI date for you.
Okay.
It happened to me. The day I received my contract, the next 2 days I was booked for RCSI.
Okay.
So imagine if I wasn't joining RCSI classes
Class. Yeah.
on Nurse Momo's Telegram page. It was really
Okay.
helpful to me. So the moment you make up your mind and open an account with NMBI, you should start preparing RCSI. That's what I can say, because you don't know what job offer your employer may be giving you.
Wow. Wonderful. What, Wendy, anything you want to say about this?
Yeah, so just as Abna said, immediately you get your offer, or sorry, immediately you submit your documents, you're supposed to start preparing. Because
Yeah.
as time goes on, when your DL comes in and then your AWS comes in, you'll be booking for a flight and stuff. Meanwhile, they've already paid or booked you for the RCSI exams. And then
Yeah.
if you are not prepared, you will find yourself wanted.
Yeah.
My situation, for instance, I got here on Thursday and then my exams was on Saturday and Sunday. So if I wasn't prepared back home, you can just imagine.
Yes.
Can you do every preparation on that Friday to sit for your exams on Saturday and Sunday? It will be impossible. So it's good to prepare back home before doing everything, like coming here.
Thank you
That's all I
so
have to
much.
say.
Thank you so much. Faith says, Sandra, you are very right. Only God can sustain us. Yes, definitely. Only God can sustain us. And then we have Sophia. I'm loving this session. Thank you, big sister Sophia. Really grateful. I can't wait to meet you in Ireland. And then we have Gloria. Gloria says, Sandra, all the way. Hand purple blue piece. Oh, Sandra, you got some cool vibes over here. And then we have thanks to Becca, babe. I knew Nurse Momo through Becca. Yes, Becca is a very wonderful lady. She's been very supportive, and I'm really grateful to her. And thank you so much for joining my page as well. She's been so good, and I always connect with her. She's always available to help me as a sister. So Becca is a very, very, very good lady, very, very selfless. And then we have Beatrice. Beatrice says, we appreciate your effort for such educative information, guys. Thank you so much, Beatrice. And we have Nanel says, kudos, guys. Thanks for this information. Thank you so much, Nanel. And then we have Satufia. Any news on what is causing the blockage in insurance of AWS? I can't say much about that, my big sister. And then we have Getru. Getru says, well done, Desmomo. You guys are superb. Thank you. Yeah, equally awesome. And then we have Bisto, yes, its red list also relates with Nigeria and Ghanaian nurses for jobs. Currently, we can't say much. We are waiting for more information, just as I said earlier on. So kindly forgive me on that. And then we have Winifred says, "Well done, Desmomo. Thank you so much, Winifred. And I know you. I know you are from my Telegram page. Definitely, I remember your name. Thank you for joining us, and also thank you for sharing with your friends as well. So, Fire, thank you so much for the love. Thank you so much. I really appreciate it, big sister. And then we have Grace. Grace says, please, that a child born in Ireland gets automatic citizen. Okay, so this is not relating to today's session. I'm actually planning on all that when it comes to social world benefits and all some of the benefits when you come into Ireland. So please hold on to that for me. But I can just say a simple answer: it's a no. Okay, but when you are applying for your citizenship after 5 years, all your children equally qualify to also become citizens. That is the little I can say about that. And then we have Victor says, "Well done, guys. Well done, Victor. Congratulations on your pin. Well done." And then we have Bendy. Bendy says, "Let's will kindly make a video on things to pack when things to pack to Ireland. God bless you. I will do my best. I'll do my best with that. I will do my best. I actually have it written down right now. Please your suggestions flow. Anything that all you want me to do a video on, more than what it's. I really welcome such statements." And then we have Abigail. Abigail says, "Great job, guys." Evelyn says, "Well done, guys. Thank you so much, Evelyn." Evelyn is my classmate. She's also an admin on my Telegram page. She's been so helpful. Thank you so much, Evelyn. I appreciate that so well. And then we have Grace. Grace says, "Great job." Thank you, Grace. That is our last question, guys. It's been an awesome time with you all. Any final words to our viewers? Nathan?
Well, I just want to encourage you. I know all the things we've said somehow might sound intimidating, but the point is when you finally settle in, things get easier. And the tension that you feel from the beginning, you kind of ease in a bit. So just soften up your mind. Know that when you move in, your first 3 to 6 months are going to be a bit harsh, but then afterwards, things are going to, soften for you. And so, to me, I think it's a journey worth taking. I would encourage everybody who has the determination to take this step. Thank you.
Thank you. Wendy, from you, any final words, please?
Okay, so all I have to say is it's doable.
Thank you.
Like here, LCSI is doable, adaptation is doable.
Kindly augment your
One-
voice. I want to hear, the Irish accent.
Okay, I said it's doable. You can do it.
Yeah.
Okay, you can do it. And then you need to know that in everything you do, like God first, yes, but when it comes to the exams, you should know that IPC counts in every station. Even with adaptation, IPC counts. And also patient
Some of
safety.
us don't understand.
Infection
Infection
prevention
prevention
control.
control. Yeah.
Yeah. So
Yeah.
hand washing, hand hygiene habits with alcohol, like it really counts in every station, even with adaptation, that also counts. And when it comes to patient safety, you can't compromise patient safety in any way.
Anyway, yes.
In all stations, you can't compromise patient safety. As Victor said, sorry, as Nathan said,
Uh,
during his
it's
adaptation,
allowed.
like,
All right.
yeah,
Yes.
patient safety also counts. But overall, it's doable. You can do it.
Thank you. It is doable.
Yeah, it is.
Sandra, our Irish nurse, congratulations.
Thank you very much. Thank you. So what I would say is very short. Don't give up.
Yeah.
Like any stage you are currently at, don't give up because you can reach where we are too. And yes, God first. And also, I wanted to say something I forgot. Well, don't give up. If I remember, I'll come in again.
Yes. Let me go to Abna. If you remember, let me know. Abna, my Miss Tina Abna, tell me something.
Okay, so basically, all that I'll say is with God, all things are possible. There's nothing you cannot do.
Yeah.
If you set up your mind to achieve it, determination, perseverance, and hard work will get you there. And so the little thing I can say is as you are coming into the Ireland nursing system, don't come with any stereotyped behavior or attitude. Don't come and pose yourself like I'm a nursing officer from my country, I'm an in charge from my country,
Very,
I'm a
very important.
CNO. Please don't bring that here.
Yeah.
Please. You need to learn and unlearn.
Thank
Don't
you.
come and impress. Pretend like you have little knowledge about it and so you need top up.
Yes.
Remember, it's your number of years you have served in your country that is going to increase your salary. But
Yes.
for your rank, it's a staffness.
Yes.
So as you are coming, humble yourself. Don't come and impress.
Yes.
Don't come and post to them that I know this medication. We are used to some common medications in Ghana. When you come here, there are varieties. Please calm down and learn from them.
Yes.
Don't bring your, those attitude here. I know what I'm talking about. Don't bring that
Yes.
here. Else they will be pointing fingers at you. And
Oh,
remember, back home, we go for night duties without any allowances or anything. When you come, when you are
yes.
given night shift, grab
Thank
it,
you. Thank
because
you.
night shifts are double pay. So grab it
I
when
want
you
everybody to
come.
see your faces when you mention the money.
I say grab it because it's
Grab
a
it.
double pay. When you are called to come to work on weekend, grab it. It's
Very important.
double. Very important.
Very,
Don't be
very, very,
lazy. Don't be
very,
lazy.
very.
We are here to learn, improve ourselves as far as our career is concerned, and also l'argent.
Very
Anything that
important.
will increase your salary at the end of the month, please put laziness aside and
Mhm.
grab it.
Thank you.
Learn and unlearn.
Yes.
That's all I'll say.
Wow. Very powerful words and encouragement from each and every one of you. Sandra, have you remembered what you wanted to talk about?
I was just saying, I wanted to say that be ready to learn and relearn a lot of things, because there are lots of online courses you'll be doing. Even after you've gotten your PIN, there are a lot of online courses you'll be doing to do. So be ready, like be emotionally, mentally, physically prepared to go through the process. Yeah, that's all.
That's wonderful. That's wonderful. Thank you guys so much. I really, really appreciate you all because right after I called you all, you were all ready. None of you shook your head. You're like, yes, Sister Lucina, why not? We can equally give out to all our nurses, overseas nurses as well. So I'm really, really happy that you guys equally came on this platform to also share your experience and also your knowledge and also encourage our fellow nurses. I think we have a few questions. I'll just brush through them and then I'll just do our final closure. We have Sandra says, thank you for the insightful presentation. There's more in your team. My question is, why need proof of funds for the Ireland process? You don't need proof of funds, but you just have to provide your payslip and also your bank statement. They just want to make sure that your pay slip, whatever the name of your hospital is being shown on your pay slip, and whatever amount that you're taking on your pay slip is also showing in your bank. Okay, so that connection should be there. However, I encourage you to read everything on the immigration website to have more information about this. And then we have Vivian saying, I'm very happy seeing you, Sandra. Thank you, Vivian. Felicia saying, there's Abda, you'll be too much. Thank you so much. And then Sandra said, yeah, Ghana, that's we run plenty night, which is without Tia. Okay. So she's saying it's not just Ghana, but the whole of Africa. All my African nurses here, I really appreciate you, whether you're from Nigeria, from Zimbabwe, from Zambia, from Namibia, wherever you're joining us from, I appreciate each and every one of you. And everything that we've discussed here, when you're referring to home, you're referring to where you're joining us from as well. Thank you so much. I really appreciate you all. Thank you. Please, if you know you still haven't subscribed to this YouTube channel, kindly remember to hit the subscription bell as well. If you still haven't liked this video as well, please like this video because the more we like this video, other people also chant on it and they can also benefit from this video. If you are an Irish nurse here at the comment section and you want me to host you on any important topic that you want other people to equally benefit from, kindly just send me an email via nursenamomo1@gmail.com, or you can find me on TikTok. Very, very important. Now I'm on TikTok, nursenamomo1, and I'm also on Instagram. When you don't laugh at me, I'm now on TikTok. So please follow me on TikTok, Nurse Namomo1, and also on Instagram, Nurse Namomo1. Please join me. You can send me a message. Sometimes it's quite overwhelming with all the emails, but I try to answer each and every person at my free time. You should all understand me. I have some emails coming in and also have some messages coming in, but I do that at my free time. Thank you so much. Please remember to share this video on your platforms, on your WhatsApp platforms, especially our nurses on their different nursing platforms. Kindly remember to share this as well. Thank you all so much for joining us. Thank you, Nathan. Thank you, Wendy. Thank you, Nasabona. Thank you, Midwife Sandra. God bless you all and God protect your pin as well. Thank you, guys, and see you
Thank
all soon on
you.
my next video. Bye.
Bye.
Bye.